Paget's disease of bone, the second most prevalent bone disease after osteoporosis, is a chronic, treatable condition. In this disorder, there are areas of bone in which too much bone tissue is broken down, and the new bone that is formed to repair it is abnormal and weak. People with Paget's disease can experience bone pain, arthritis, fractures, and bone deformities, as well as other complications.
The skeleton is very dynamic and constantly being repaired by cells that remove bone, the osteoclasts, and cells that build bone, the osteoblasts. At sites of previous bone removal, the bone is filled in with new high-quality bone. But in Paget's disease, the cells that remove bone are abnormal, so that there's tremendous loss of bone followed by tremendous new bone formation that is of poor quality.
Normally, bone is remodeled in a way that keeps it strong with a laminated structure. The key features of Paget's disease at the level of bone are excessive removal of bone by abnormal bone removing cells and an attempt by the bone repairing cells to overcompensate. But unfortunately, this results in a structure that's more like balsa wood than plywood, resulting in enlargement but weakening of the bone.
The disease can affect any bone, but usually occurs in the spine, skull, pelvis, thigh, and shin bones of older adults.
Paget's disease of bone is usually detected in individuals over 50 years old, both men and women. The prevalence varies widely from one country to another. Probably it's the greatest in the United Kingdom, very rare in Asia and Africa. In the United States, about 1% of the population are affected, with a higher risk amongst people who have a close relative with Paget's disease. Interestingly, in the United States, it's probably just about as common amongst African Americans as amongst Caucasians.
I was having knee pains, and which I thought was arthritis, and so I went to a rheumatologist and found that had my first x-rays taken and nuclear scans, and in that they found that I had Paget's bone disease.
The disease has affected me physically by a little loss of my hearing. I have pain in my back, terrible pains. I'm unable to sit properly, and it affects my hip and the way I walk.
Because the condition can easily be confused with arthritis or other disorders, proper diagnosis is crucial.
Paget's disease is diagnosed almost entirely by the use of x-rays. They are so typical in their appearance that it's almost definitive in most patients. Rarely will a bone biopsy or taking a piece of bone be necessary. A complementary test is a bone scan, which is a nuclear test in which a picture is taken of the entire skeleton, shows the areas of Paget's disease, which can then be x-rayed to affirm the diagnosis.
The clinical features of Paget's disease result from the abnormalities of shape and structure in the bone. And these can include enlargement of the skull, enlargement or deformity of bones, bowing of the weight-bearing bones, altered shape of the bones that are involved in joints, and it can even involve enlargement of the vertebrae in a way that will affect the spinal cord.
While there is no known cure for Paget's disease, it is a treatable condition. Drug therapy can slow the rate of bone loss, build up new bone, and lessen pain.
Since 1978, a variety of drugs have been introduced for the treatment of Paget's disease, most of which have also been used for osteoporosis. The first one was calcitonin, a hormone which is no longer used very much. Subsequently, drugs called bisphosphonates have been introduced, some taken by mouth and some by intravenous infusion. These have been highly effective in controlling the disease. The most recent one, zoledronic acid, can be given in a few-minute infusion and produces a remission of the disease for years.
The infusion, when I started with the infusions every 6 months of parmetanate, And I don't know, just when we're on the newest one right now, that I'm going up, could go up to 2 years without any treatment. And I just, every time after the treatment, just felt even better. And I feel now, from day to day, I just feel very good.
I've had several types of treatment. I've had the pill, I've had injections and infusions, and I had 4 different surgeries, 2 on my left arm and 2 on my right leg.
In appropriate patients, surgery is necessary. The most common surgical procedures needed are hip replacements when Paget's disease affects the pelvis or thigh bone, knee replacements when the knee is painful, and in some patients, straightening of a crooked lower extremity is necessary.
I'm feeling great now, and I'm doing very well. In fact, last night I said, so we go dancing every Wednesday night, Teresa and I. So they're all over the hill gang people, but we hold our own.
The mission of the Paget Foundation is to provide information to patients and healthcare professionals and to advocate for expanded research on all bone diseases.
There's lots of new research ongoing in Paget's disease. Both environmental causes as well as hereditary causes have been linked to Paget's disease. The most common research now going on is to try to understand how these factors contribute to the abnormal osteoclast activity, bone resorbing cell activity in Paget's disease. The environmental cause that seems to be most prominent is measles virus, while the hereditary causes have been linked to several genes, and ongoing research is trying to determine how both these contribute to the development of Paget's disease.
For more information, please contact the Paget Foundation for Paget's disease of bone and related disorders, or visit its website at paget.org. This program was funded through an educational grant from Novartis Pharmaceuticals Corporation.